Dr. Patil, we are unable to see you. Dr. Patil, just keep your camera on so that...
My camera is on.
Okay, fine.
Can you see me or you can't see me?
Yeah, we can. So,
Yes.
welcome to BW Healthcare World. Today is World Organ Donation Day, and it was imperative for us to have a conversation with someone who is evangelizing this cause of organ donation. And we have with us today respected Dr. Bhageshwari P. Patil, who's a pro-chancellor of Dr. D.Y. Patil Vidyapeeth, Pune. And she's someone who really believes that this is a topic that needs to get attention. So, Dr. Thank you so much for joining us today. Dr. Patil, my question to you is that organ donation has always been a very sensitive topic, especially in our country, where you have different religion, social strata. How do you address cultural and religious barriers that prevent people from considering organ donation?
Yes. Firstly, I would say that organ donation is really a very important topic and a very sensitive topic. But as in a Sanskara, as in a Shastra, Indian culture, we know that when we get up, we always say, Shubham Karoti Kalyanam Arogyam Dhana Sampada. So health is the wealth. So we should have really good health. And for this organ donation, this is a very sensitive and emotional topic. There are some cultural and religious points. But when it comes to that, we really make the donor family to understand how the donation will benefit for humanity.
Mm-hmm.
In some families, we have seen in patients' families, there are some religious priests who sometimes interfere. Then we try to convince them, and they're really convinced for the human cause.
Mm-hmm.
Or elderly person in the family. We try to explain them that how it is beneficial, and whoever is the donor, he can save so many lives.
Mm-hmm.
It's about saving 7 to 8 lives from a donor.
Correct.
And I really feel that, of course, we have great faith and great respect from the donor family. We take care about that, but we really imbibe. We make a good, we keep conversation, and we are very free and frank. We openly tell them how it is going to be.
Got it.
Yeah.
And Dr. Patil, I believe that the belief in the benefits of organ donations is an outcome of the belief systems that people have. and education can actually make a difference in educating people on the importance of this and overcoming the social barriers, the religious barriers, etc.
Mm-hmm.
What are you as an educational institution doing to impart this kind of an awareness on organ donation at your institute?
Yes. Dr. D.Y. Patil Medical College and Research Institution is a very we have a solid reputation about organ donation. In fact, we make the people aware. In fact, we have gotten Best Award for Organ Donation in 2023. And we really have, in our institution itself, we have given organ donation, we have made booths for it. We have CMEs. In fact, last 2-3 days, we had a CMA with Indian Medical Association of Pimpri-Chinchwad. And we called all national speakers to speak over them and to upgrade everyone, to make awareness, to have that awareness that how it is helpful. More only not about the donation, but we tell them about the ethical part also of it.
Got it. And sorry, please go ahead, Dr. Patil.
Yeah, we also send experts to schools, universities, colleges, and tell them how important it is, that after donating organ, nearly 7 to 8 lives of the people are saved. 7 to 8 life of urgent patients, in fact.
Got it.
Yeah.
And Dr. Patil, we are seeing a lot of advancement in technology, especially when it comes to healthcare and well-being, the medical technologies.
Yes.
How do you think the advancement of medical technology is now creating an impact on the future of organ donation or transplants in India?
See, organs are very precious. We can't count it in money or anything. It is very precious, Means I personally feel it is to my heart. And it is impossible to get an organ again or anything, If it is spoiled, someone has to donate, and then only we can survive. The patient can survive. And supposing if we have a liver transplant, if it has to be taken from the donor, it has to be implanted within a limited time, nearly 6 to 7 hours. So to take that donated organ and then put it in the recipient within a limited time, that also we have to put it in the recipient within 4 to 6 hours. It has to be operated surgery, And then nowadays, because of the technology, we can after the donation we can preserve the organ for nearly about 7 to 8 hours because of technology, advanced technology. Organ preservation fluids are there, organ perfusion pumps are there, so we can do that. And moreover, our country has to, because of artificial intelligence and modern technology, robotic surgeries has been done very well, but we have to still go ahead. In USA, there are drones for organ transplants. I think in India, we have to start that also. Drones can help to give it. Of course, no doubt, we have got green corridors. The Indian government is helping. The police department especially. To donate the organs, I will tell you one incident. We had to get an organ from Sangli, Kolhapur to Pune. There were 350 police people working for us for one organ. And I really salute those people who really manage that time limit and send the organ and the recipient receives it.
Right. And Dr. Patil, apart from technology, but there are a lot of these legal and ethical considerations that need more attention in the field of organ donation in India. Do you have a comment on that?
Yes, there are a lot of rules and regulations. And nowadays, hospitals, even at our DPU, we follow those rules and regulations strictly. In fact, there are centers, organizations like NOTO, National Organ and Tissue Transplant, then ROTO, Regional Organ and Tissue Transplant. Then we have the SOTO, State Organ and Tissue Transplants. Then at a regional level, we have the ZTCC. So in Maharashtra, we have the zonal ZTCC. And they have some rules and regulations. And it is important to follow those rules and regulations. But still, there are some regulations which have to be improved. There are some rules and regulations that we need to improve compared to US and other countries. We really want to work on that. And I'm sure the government and the media also will help us for it.
Right. And Dr. Patil, there are a lot of these misconceptions about organ donation. A lot of people have fear that the organs will be trafficked, and there are doubts that are created in their mind about the ethical use of these organs. How do you address these fears and ensure that there is transparency in the system around the organ donation process?
Yes. See, there are lots of misconceptions and myths, but we have to go away with it, because there's right information possible. You all can read it on the Noto, Soto, and Roto. Everywhere there's rules and regulations are laid very well. And even when there is a donor, immediately ID is created, and the recipient, and they can interact. Moreover, our organization, we have a committee of surgeons, physicians, everyone. We have a committee, and then they sit together and see to it that everything is ethical.
Right.
Yeah.
And Dr. Patil, anything that is less in supply, for example, organs. There are more organ recipients who are in line, and there are very few donors that is there, and that leads to the issue of allocation. And then you have people who will influence or use money to bypass the line. How does the allocation of organs become a contentious issue, and especially when it is related to prioritizing the recipients? How do navigate the ethical dilemmas that could be there when it comes to life-saving organ transplant?
Yes. See, organ allocation, it follows the principles of justice, equality, and fairness. We have to be really very, very fair. And the committee which is there, they really work on it. But sometimes it happens that a recipient cannot survive for more than 36 to 48 hours. And there humanity comes into place. And there people are ready to pay whatever they want to. And then these malpractices are there. Sometimes it's there. But the government is very strict. And we ourselves are also very strict about it. We have got the high management, top management involvement of everyone, and meticulously we see to it. We check everything. In fact, we check at the ground level. Really, the families are together. We have got people who do the study of everything, and we leave no stone unturned to see that everything is into proper place and everything is ethical, or we don't go ahead for that. But that time, there's a good point also. If a patient is sick for 36 or he might live only for 36 or 48 hours, that time we make a team and we then convince the organization, and then they say there's a super urgent patient. And then the organ is allocated to the super urgent patient. But right, you said that the demand and supply.
Right.
The society has to be aware of it.
Absolutely. The demand and supply is
Mm-hmm.
And I think, that is where the education comes in. Like I was telling you that, there's a role that education comes in. There is also a role that media can play. We are all very, very keen to support this cause.
Right.
It requires a lot of collaboration. What do you think, since you are into this, you're evangelizing this concept, how do you think media can partner with institutions to create that awareness, take a role?
See, media plays a very crucial role, very important role, in fact. See, let me tell you an instance. There are media people are there for anything if happens in the society, maybe criminal or any news. There are special media people for that. And you'll have been allocated. But for organ donation, we have to have some in Western countries, in USA, there are special reporters for transplant reporting. And here to explain this, we should have, in USA, the reporters designed for organ transplantation. See, we have got reporters designed for maybe film, maybe entertainment. But for organ transplant, if they are reporters, I think hospitals, we can start guiding them or teaching them what exactly is from the donation point of view to the recipient point of view. So there's I think everything will be open. So you have to create those reporters also for organ transplant, and that will go a long way if they learn this. And
Right.
then I think everyone will understand the importance of organ donation. And it is very much necessary. I tell you, I'm very much emotional about those people who do the organ donation. Every time, whenever a person is donating organ, there are always tears in my eyes, because that is really humanity, I tell you. And it is very sad that the donation, the person who is donating the organ, it is a very sad picture for them, the person has passed away. But after some time, they really realize that they can see their own child, or maybe their own husband, maybe their own mother in the other person. And then that feeling.
Dr. Patil, I'll take you from there. When you're talking about emotions, I totally agree with you. It's a very emotional moment when somebody passes away, especially for the close loved ones who are around.
Absolutely. Mm-hmm.
And the time when they're asked for the permission to allow the body to be used for organ donations.
Yes.
What in your experience has worked so that without hurting their sentiments, we are able to align them to the goodness of what they're expected to do?
See, because they are families, they really want the patient to be survived. And it is a very difficult task. See, we have got all senior anesthetists, senior ICU people who know that, that the person is a brain death person. And we try a level best for them to survive, and we really face that point, no doubt about it. But, when they read, or when they see, or when they, sometimes it happens when the donor family, there's a recipient going on, there's a operation going off, of it is recipient. And when they hear the recipient story, sometimes the patient's relatives exchange each other's points. And then that way they, I think, must have some positive thought must have come inside it. And the environment, I don't know exactly what happens, but then they get convinced after 2-3 days, or must be after 8 days, or whatever is it,
And Dr. Patil, the donors are not always the ones who've passed away. There are living donors also that are. And again, there's a lot of unscrupulous activity that is happening where people are paid money to donate and other things. Let's leave that aside. But otherwise, who are the living donors, such as donating a kidney, or for that matter, a part of their liver, they do face health challenges post-donation. What do you think is the responsibility of the healthcare delivery mechanism to ensure their long-term health and well-being as a donor?
Well, in DPU, we have an excellent system to ensure the safety of the patient, long-term health of the society. In fact, we have seen patients of kidney donation who have survived for more than 15, 20 years, even more than 35 years also. So we have a set of doctors, physicians, cardiologists, infection control people, emergency medicine people, and then psychologists also. At every angle, maybe dentist, pulmonary people, and to ensure that wherever help is needed, we guide them. Of course, it is clinical help also, and mental help also, emotional help also, that is, I personally feel emotional health is much more needed than clinical health. To make that positive thought imbibe in them. And we at DPU really work at to create a positive thought, to create manifestation that everything will be good. In fact, doctors also, we always tell them that you have to manifest that the recovery will be there. And I think somewhere that works. I have experienced it myself, that manifestation. Because when we had started organ donation, it is my own experience. For 1 year, there was one 32-year lady coming near me. Madam, please help me. She was carrying an oxygen cylinder on her back. And madam, please help me. She was working in Bank of Maharashtra. And she used to come on a two-wheeler and say, madam, please help me. I am on nearly 9 years. She was on oxygen, sir. So can you imagine that her life was such tragically? And now I wish she was here to interview, And now she's living a very peaceful life. There are many cases of such. For pancreas transplant, an engineer person of 30, 32 years can survive. So,
Got
you
it.
know, it is really a good humanity, and I really feel God is there when we do something good. Some supreme power, some supreme bliss is there if we do good work.
Got it. And Dr. Patil, my last question to you before I let you go is that there's an existence of black market, again, for the same reasons like we were saying, there's a demand and supply gap. And that's the harsh reality in some parts of the world, including in India. What do you think can be done to safeguard and to prevent the exploitation and ensure that the organ donation remains ethical and legal?
See, now this black market is really a very harsh and a shameful reality. And which I hope everyone will be able to get rid of it. In fact, in India, we are very, very strict. This has happened in other countries like Bangladesh and all that, but in India, we have got very good rules and regulations. But when a person is sick, the patient, the citizens themselves have to be aware. They should not do this crime. They should not they should not be prey to this crime, because somewhere or the other, help will come for them. And this, they should not, our own citizens have to be aware of this. And they should not indulge in this black market because a loved one is sick. Because, getting a good organ, because when the donor is doing the donation, our physicians, our cardiologists see that the organ is very healthy and proper so that we can donate it and give it to the recipient. And then the patient can live a longer life.
Got it. I think that is very, very important. I think, this is emotional.
The government is also very serious about this. And there is a harsh penalty for anyone who indulges into such acts. But I think media can do a greater job.
I think, yes, I totally agree with you.
Yes.
First of all, I think it is a good deed to be done by every human, because that is the only way that they can live beyond the living life. Yes. And second is that I think it is time that both the educational institutions as well as the media comes together to not just share the message, but to inspire through our stories and encourage people to take that step to go pledge that, they are going to make a difference even when they're leaving the earth as a living being. So I think it's a responsibility
and everyone has to pledge for organ donation. And we are the only first academic institution who have done more than 379 transplantations. We are the only academic institution who has done heart and lung transplant, 17 lung transplant. In fact, 1 lung transplant is going on just now also. It will be the 18th lung transplant. And we have got good set of doctors who are doing this. We have got Mr. Attawar, who comes for heart and lung transplants. Then cardiologist, we have got Dr. Dige for kidney transplant. For pancreas, we have got one of the topmost doctors, Dr. Roshali Patil. And then for eye cornea transplants, we are forming a set of people. It was, to tell you frankly, it was very difficult to start this program. Of course, now also we are in coordination. We need to be in coordination from the down people, from the coordinators to the surgeons. And that has to be managed in a limited time.
Ma'am, anything that is meaningful is tough. And anything that is tough is something which is worth doing. I'm sure it is a very fruitful experience for you. We'll be happy to work with you to spread the message and encourage people to take that step.
We, in fact, in our institution, we have competitions on singing competitions. We do nukkad, some short plays. You'll be shocked. Our UG students have done film on organ transplants.
Oh, lovely.
Short films, and the students are also aware, So I think this awareness has to be gone far off, and it has to be nationally very much. And my intention is to really get it at that awareness should everyone till the down level, from village people to the down level, And if this drone system starts from a village, people also, if there's any donor, they can get it for a person. And I think this gap has to decrease, the demand and supply gap. That is very much essential in India.
Absolutely, Dr. Patil, we are with you on this.
Thank you.
Dr. Patil, thank you so much for taking our time. I know you are a busy person, but it is something which is very, very important for our society. So thank you so much for taking our time to speak with us on this World Organ Donation Day.
Thank you so much, and wish you everyone a good organ donation day. And I request everyone to promise to pledge your organs.
Absolutely.
Thank you so much. I have done it. Have you all done?
Absolutely, yeah. I've done.
Yes, yes, okay.
Thank you.
Thank you so much. Thank you.